Hey, what's up guys? It's me, ThePsychNPDavidC. So today I'm going to walk you through 10 things everyone should know before starting an antidepressant. I pretty much tell all my patients these 10 things when I first start them on an antidepressant. Whether it's your first time or if you've tried them before, these 10 tips will help you set realistic expectations, manage side effects, and understand how antidepressants really work. Let's talk about it. So number one, antidepressants are not addictive. This is one of the biggest misconceptions I hear not only from my patients, but from my friends and family as well. A lot of my friends have actually told me that they don't want to start antidepressants because they're scared they're going to get addicted to them. But the truth is, antidepressants don't actually cause any cravings or dependence like other medications do. Like, you're not going to get high if you take antidepressants. So taking them as prescribed is very safe. With that being said, stopping them abruptly can cause withdrawal symptoms, which is why if we decide to stop the antidepressant, we always taper you off slowly so you don't get those withdrawal symptoms. But the actual medication itself is not addictive. And number two, they take at least 4 to 6 weeks to get the full therapeutic effect. It's a very common misconception that antidepressants are like happy pills, where like if you take one, you start feeling happy right away. But the truth is, you need to take them consistently every day for at least 4 to 6 weeks to actually get the therapeutic effect. And this is 4 to 6 weeks of taking them at an optimized dose, not the starting dose. If you're starting a new medication, your provider will almost always start you at the lowest dose just to test how your body reacts to any potential side effects. So for example, there's an antidepressant called Zoloft. The dose ranges from anywhere from like 12.5 milligrams to 200 milligrams per day. The general recommended therapeutic dose is at least 50 milligrams, but your provider might start you at 12.5 or 25 milligrams at first just to see how your body reacts to the side effects. Then after 2 weeks, your provider might decide to increase your dose to 50 milligrams. So it would be 4 to 6 weeks from the time you start the 50 milligrams that you would feel the full beneficial effect. So yeah, taking antidepressants can be a big commitment if you want to get the full therapeutic effect. And speaking of side effects, that leads us to number 3. Side effects are usually temporary. Most antidepressant side effects are supposed to go away within 2 weeks. A lot of common ones include nausea, diarrhea, headache, or even anxiety. So when you start an antidepressant, the first 2 or 3 weeks is going to be pretty rough and you won't feel the actual antidepressant effects until 4 to 6 weeks. And number 4, they should be taken every day. It's very important to be consistent. You should be taking it at the same time every day, pretty much. It helps maintain stable levels in your system, which maximizes its effectiveness. If you skip doses, it can actually reduce the effectiveness and even induce withdrawal symptoms. Most antidepressants are supposed to be taken either once a day in the morning or once a day at nighttime. And number 5, if you miss a dose, don't double up. For example, if you forgot to take your antidepressant yesterday, don't take double the dose today to try to make up for it. Just take your regularly prescribed dose. If you take double the dose, it actually increases your chance of getting side effects. So a good tip is to like set an alarm on your phone so you remember to take it at the same time every day. Number 6 is that we always start you off at a low dose. A low dose means it's sub-therapeutic, which means if you keep taking it at that low dose, you're probably not going to get any therapeutic effect from it. I kind of covered this earlier, but we always start at a low dose just to test how your body reacts to any potential side effects. Generally, if you're able to tolerate the side effects for about 1 or 2 weeks, then it's safe to increase your dose to the next level. That's why adjusting the dose of antidepressants always takes like months, because we need a couple weeks to see how your body reacts to incremental dose changes. Using the example of Zoloft earlier, even if someone goes from like 25 milligrams to 50 milligrams, it can actually make a big difference in their body. Moving on to number 7, one size does not fit all. Just like any other medications, different people respond differently to antidepressants. Just because Zoloft worked wonderfully for your friend doesn't mean it's going to work wonderfully for you. A lot of times, prescribing antidepressants is kind of like trial and error. We recommend one that's best suited for your situation, and then we see how your body reacts to that medication. There's plenty of different antidepressants, so don't get discouraged if 1 or 2 don't work for you. And number 8, antidepressants can treat more than just depression. While they're called antidepressants, they're actually effective at treating things like anxiety, OCD, or even PTSD. Believe it or not, the first-line treatment for like general anxiety, OCD, PTSD, depression, they're all antidepressants. So even if your main concern isn't depression, your provider might still start you on an antidepressant. And number 9, there's different classes of antidepressants. There's classes called SSRIs, SNRIs, TCAs, MAOIs, and others. Basically, each class has its own set of neurotransmitters that it works on. For example, SSRIs work on serotonin, SNRIs work on serotonin and norepinephrine, so each class has its own set of general side effects. SSRIs are usually the first-line treatment because they generally have less side effects than the other classes. When we providers are prescribing, our number one priority is always safety first. And lastly, number 10, every antidepressant has both a generic name and a brand name. So let's use the example of another common antidepressant with the brand name Lexapro. Now, the generic name for Lexapro is escitalopram. I prefer to say Lexapro. Why? Just because it's easier to say. Like, who wants to be saying escitalopram every time you need to say escitalopram when you can just say Lexapro? The reason why this matters is because most prescribers will prescribe you the generic version of the antidepressant. We do this because most of the time it's cheaper for you if we prescribe the generic version as opposed to the brand version. So even when I'm telling my patient that I'm going to prescribe them Lexapro, I always remind them it's going to say escitalopram on the bottle because that's the generic name for it. In most cases, there's no difference in taking the generic version versus the brand name version of an antidepressant. Just make sure you know both names of an antidepressant so you don't get confused. So that's 10 things everyone should know before starting an antidepressant. Just remember, antidepressants take a lot of work and you're probably going to feel the side effects first before anything. Finding the right one for you is a process and requires commitment. And don't hesitate to reach out to your provider if you have any questions or concerns regarding your antidepressant. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there. I also do telehealth medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.